turn it over to Dr. Sharif.
Thanks, Jonathan. My name is Dr. Shami Sharif. I'm a senior health advisor here at the Oregon Health Authority. I've been helping with the COVID-19 response. Thank you again for everyone for being here. I'd like to provide an update on a Centers for Disease Control and Prevention investigation that has been initiated in response to the death of a person in Oregon who received the Johnson & Johnson COVID-19 vaccine. The individual is an Oregon resident, a woman in her 50s who was given the Johnson & Johnson vaccine early this month. She received the vaccine prior to the CDC and FDA recommended pause on use of the Johnson & Johnson vaccine, a pause that Oregon also recommended for its providers on April 13th. The CDC was notified of this adverse event on April 18th, and OHA was notified on April 20th. The event was a rare but serious blood clot that the woman developed within 2 weeks following vaccination, seen in combination with very low platelets, which are a type of clotting cell. Cases of the blood clot, known as a cerebral venous sinus thrombosis, has been identified in 6 women around the country between the ages of 18 and 48 who received the Johnson & Johnson vaccine. I want to emphasize that at this time, we do not know whether the Oregon woman's death is related to the Johnson & Johnson vaccine. Her case was reported to the CDC through the VAERS system, the Vaccine Adverse Event Reporting System, which is the national reporting system used to collect reports of adverse events after vaccination. Healthcare providers are required to report certain adverse events after COVID-19 vaccinations in accordance with emergency use authorizations for the vaccines. Such events include death, any life-threatening event, and inpatient hospitalization. The case in Oregon will add to the evidence of potential risk associated with Johnson & Johnson vaccine, and which the CDC's Advisory Committee on Immunization Practices, or ACIP, will review to weigh the risks and benefits of the vaccine. These considerations inform the ACIP's recommendations regarding the use of the vaccine going forward and shows how the system for monitoring, quickly reporting, and investigating these events is working. The CDC and OHA will inform the public on any developments during the review and investigation process. We will also encourage everyone in Oregon to schedule an appointment for the 2 available COVID-19 vaccines made by Pfizer and Moderna when appointments become available. Remember that all Oregonians 16 and older are now eligible to be vaccinated. Thanks, and I'll be happy to take any questions.